There, that's great.
So, the reason why massaging the hand and foot has such a benefit is because of all these structures. And whenever you have structures that overlap and function together, you've got nervous system that is monitoring all that. In addition, in both places, you have got a lot of circulation and you have got a lot of lymphatic vessel stuff, which is part of how you create that pump when we try to move fluid around the body. So fluids move by a pump. So we've got the heart pump, but for the return of the venous blood, it is pumped actually by the action of the muscles contracting against it, pumps it uphill. Strange design. So the lymphatics is just like this network of roots, like a tree, and it has to suck water up by a pressure gradient thing. So if a tube has got a low pressure in it, it's gonna suck up, just like when you suck up a straw. So the water will go into this tube, and it's the pressure of the structures and the movement of the skin and the compression that happens when we step or squeeze that is that pump. So we've got the nervous system and the fluid system that is working in conjunction, along with the very mechanical pieces that Luke went over with you with the bony structures and how those Legos fit together. Because of this, entire systems have been organized around foot and hand massage. And you've probably heard of the term reflexology. So the reflexology idea actually came out of China, we think. Oh yes, and that's important too. Let me backtrack on that.
Just the homunculus. This is called the homunculus chart. There's another terrifying version of it, which is this thing. No, this one. This will be better to look at.
This gives you an idea of the sensory motor nervous system distribution to the hands and the feet. So that's what that's showing. If you see these charts, it's called the homunculus, which also. But in comparison to the rest of the body, look at how, especially the thumb. And that's why people want to overuse their thumb to do a massage. There's a lot of sensory stuff there, but it's just not built for pressure. It's okay if you just are sliding it, but it is not okay if you're trying to press down into those structures. So, and then the foot's over here. It's a little less, but we want to think about these together and where we are going to get the best sensory input into the body. So people spend way too much time massaging somebody's back. And I think that is because people may come in with symptoms related to back pain or stiffness or whatever, but you can override in general those signals, and somebody's back will feel better. Yeah, pull that one up. Somebody's back will feel better, not because you massaged their back, but because the nervous system has had to recalibrate and adapt. Also, there's a lot of research around the idea of hand and foot massage, simply because it can be done in a setting where you don't have to have a full massage table. It can be done in a seated position. It's relatively safe. You're not gonna usually, unless there's a surgery or an injury in the area, somebody like I carry has had that gallbladder thing, all right? we can massage her feet where we would not necessarily want to massage in the trunk area. So there are systems that are set up in acute care for pain management that rely on hands and feet. There are systems that they've pulled together that are related to teaching other caregivers or family members a routine to massage hands and feet because it has such a input into the nervous system. So in an attempt to understand, way back in the day, they would have a situation where they would go, okay, if this and this kind of look alike, then maybe they're alike. And your traditional Chinese medicine system used nature a lot to superimpose. So you've got your law of 5 elements and meridian lines and all that, and that correlates nature into, okay, I can observe wood is consumed by fire, but fire is consumed by water. You know, you get those kinds of things going on. So in the body, if you have a hot thing going on, somebody's got a fever, then you would stimulate the organ systems that are related to water. So that's where the thought process came from. Will you draw me a blank foot?
A blank foot?
Yeah, 2 of them, just like that.
Okay.
All right, so I'm gonna this is in chapter 12 in your textbook, I think. You got a picture, but I want you to understand the theory behind it so you can think in multiple ways when you're massaging somebody's feet. I am not good at massage, or if I drew a foot, you would have to laugh. So, which is all right too. All right, now, the focus of what we've been trying to do here, I came in and did the head and face, and so now, did you find it? It's in your fundamentals book. Did you find the reflexology picture? I think it's chapter 12. Might be chapter 14. Did you find it? What page is that on?
574.
574. I don't know. My foot's not too bad. All right, now you want another one right next to it.
Yeah.
Because we're looking for places to spend our time, or developing a system where the person doesn't even necessarily have to take clothes off, or a system that can be done in a half an hour, or a system that doesn't necessarily need to have a lot of massage equipment. And how can you more purposefully incorporate this stuff into a massage session, knowing that you're going to get additional support for the outcome that you want, because of the nervous system and the fluid movement. So have you heard of you've heard of lymphatic drain, right? That's a big thing right now. The way the lymphatic system functions in our own body is by walking. So squeeze and lift, squeeze and lift, squeeze and lift. And then also, every time we lift our leg, we are also contracting muscles, letting them relax. That's that pump action. Whenever you think of moving fluid, you want to think of a pump. We got a fluid movement problem in the basement right now. The pump, the water kept coming in and the pump couldn't keep up with it, or a pump didn't work or something. And so when we get down there, we got somebody coming, which depending on, Matt might need your help a little bit too. Without that pump, the water accumulates. That's edema. We're supposed to recycle that all the time. And so if we can stimulate the pump, then we can keep the water from accumulating. Once it has accumulated, like we have in the basement, then we have to squeegee it. We have to squeegee it back down a drain, or we have to sop it up somehow. So when we actually teach you to take what you already know and adapt it to a particular physiological outcome, when we teach you about lymphatic drain or venous return, what we're going to teach you to do is squeegee and pump. You'll squeegee and pump. So it's not very mysterious, is it? And you're going to squeegee and pump towards the drain. So we've got drains down there and all that kind of stuff. So we're going to squeegee and pump towards the drain. And we're going to squeegee and pump starting at the drain and moving out. So that's the idea of mimic normal. So when we work with the foot, oh, you did such a good job, Luke Allen Fritz. I have to take a picture of that. Here we go. I posted one where I talked about this stuff. Wow.
Not the best representation of the body, but there is seemingly a correlation with the similar shapes that could be identified in the foot and the spine. And this is a general formula because not all reflexology charts are cohesive, but how essentially the toes, but big toe, there's stuff related to the head there. It'll be everything from the sinuses to the eyes, and the big toe being more specific to the head. But that arch, if we look at this and you look at the movements, those where the caves and the hills are of the foot, that arch where the big toe comes over, it means what we call like the ball of our foot, and that'd be the cervical spine. Then this big bowed out part would be the thoracic spine, and then the arch, that section that kind of bows back in, being the lumbar region. And then organs will get specific, but I think about this, if I ever think about anything related to reflexology, I think more on this general concept kind of things. Right.
Now, in the way back time, cultural development of that, they would look at that and they would go, wow, that foot looks like a torso. It looks like the front of the torso. And so if we do that, we got our 2 feet up there and we look at it and we go, oh, now if that was our torso, how would the organs be organized in there? And they had a general idea of how organs are placed in the body, with whether they had seen an injury where the organs were exposed in a person, or they were butchering an animal or something. They had an idea where these organs were at. So right here, where Luke's got this marked, this would be where the spine is, right? Belly button, because this is, when I look at the feet, I'm looking at this part of me. So I have a belly button, right? And at these places, we also have what we call diaphragms. They're where the tissue, instead of going more up and down or sideways, goes horizontal. And the big one we have here is the diaphragm muscle, which is our big breathing muscle. And then we've got organs that are above that and organs that are below it. And then we got stuff that's more on the right and stuff that's more on the left. So on the right, we have a liver and a gallbladder.
You got it.
All right. And some of that pushes, that's a little too much, that liver kind of pushes up and lays right up against that diaphragm in there. And then there's a little gallbladder thing stuck over here. And then over on the other side, we have our stomach and our spleen. They're below the diaphragm. And then right about mid-back, right in here, we have kidneys, one on either side. You see how it works? And then here on the left, we've got our heart, left.
Yeah.
Kind of crosses over into the midline. And then we've got lungs on both sides. So this part up here then is our cervical vertebrae and our head. So we got the main part of the head is this.
And better if I just draw his face right in the big toe.
And then we've got eyeballs.
Again, almost no charts are the same.
And then we have ears. And the reason why none of the charts are the same is once it's printed, it's got to stay with copyright. That's the truth.
So you'll see the eyes and sinuses, maybe at the tips of the toes, right in the middle of the toes. They're still on the toes, but these subtle differences will occur. So.
His ears are on backwards. There we go. All right. So here, at the base of the toe, we got all of our, the thyroid gland is down through here, because it's kind of in your neck, and we got the pineal gland and hypothalamus and pituitary and all that kind of stuff that we just learned about. Then below here, we've got our large intestine. Actually, it whops out over here, right in the middle. And then we got all of our small intestine. And then we've got, for the female, over in here, more middle, we've got the uterus and the bladder. On the outside here, if I'm going at the outside of the foot, is our limbs. Right under our ear is a shoulder. Right down here is a hip. So you don't need a chart. You just pair up the body areas once you get an idea of what's going on. Now, people are going to ask you, do you do reflexology? And the answer is, I was not specifically trained in the reflexology system. There's actually a certification process for that. But I use all of the theory that goes into that system. Because what they would do now is they would do a very precise grid going down each of these lines and then going across, and if they find an area that is particularly tender, they would go, oh, that maybe there's a strain on the kidneys. Here's where the gallbladder is. I'm going down with that. I'm putting pressure in there, and I find a spot, and they go, wow, that's really sore. Then I'm going to think, even though research doesn't say that spot goes along with the gallbladder, this concept's been around a long time. So I'm probably not going to tell somebody, oh, wow, I'm going to cure your gallbladder disease by mashing on this spot. But I wouldn't ignore it either. I might ask a question, I would think, well, what are the symptoms around gallbladder if you had any, new or unusual pain in this area. There's a referred pain pattern up into the neck, that kind of stuff, and it would potentially feed into me thinking about referring. If I've got a client that has a shoulder thing or a knee thing, while I'm working on the feet, I might spend a little extra time there. I'm not gonna say I'm working on your shoulder down here, but I know that there maybe is something. What I do know is that thorough massage of the foot along with the hands, because the hands are similarly structured, is gonna send a ton of neurological signal into the nervous system to process. Balance issues are a big deal, especially at the feet. That's gonna feed in. The foot has a quality of good hurt to it, which is gonna kick up some neuroendocrine responses that go with it. It is a form of counter irritation. You can be not aggressive, but you can use fairly firm pressure that falls in that range of good hurt. So nobody should, ever freeze up or anything like that when you're working. But just in general, that's a safe place to do that rather than using more pointed or focused pressure around the ribs or something. So lots of things going on here. We've got this reflexology theory base. We know we've got the joint proprioceptive stuff. We know that the foot is leading a lot into proprioception. We know that there's a big lymphatic plexus sponge, a big lymphatic sponge, and a lot of fluid, blood-based fluid in the bottoms of the feet. So we know that this on and off is a pump. So all of that goes into how am I going to, in general, structure massage of the foot and take advantage of all of this. That's where we're at. Are you getting out some charts?
Just, the one. And would you mind giving a chirp on how, since we can work usually a bit more aggressively in the foot, how although it may show some indications of organ-ish, maybe, this is a big but that we're not going to cause a person's kidneys to explode, and we're not going to cause birth to suddenly happen. On the lateral sides of the feet, now it's getting better, but we've talked at some length, but just to revisit, the key misconception regarding lack of safety for prenatal stems from reflexology points being associated with the reproductive system. That's where most information is coming from.
And they're doing better. They are doing better about that. But how many of you have heard, you might have heard, oh, it's not safe to do massage in the first trimester. That's not true. And it comes from a lot of things. And anytime you hear something like that where you go, ooh, that's really dangerous, you got to look a little bit bigger and see why somebody would say that or do that. So in order to I talked to Amy.
Oh, good.
Sent her to the doctor.
Good. Okay, cool.
Yeah. So these cultures overlap. So there's a meridian that runs through there. Reflexology as a system in the Western stuff started in the 1800s. But the theory had been around for a long time, primarily out of China, we think. That's the first pictures of it someplace. So in order to justify an expensive continuing education class, you have to make it dangerous.
And
If you don't
complex.
do it just like I do it, then you're gonna hurt somebody really bad. You know, that's one justification. The other justification is you can fix anything, you know, by doing this particular thing. And you're, you know, you're still in this kind of protected environment, but boy, there's some crazy stuff out there in the continuing education market. And they gotta justify charging X number of dollars for this class. I just taught you, Luke and I just taught you in an hour the foundation for all of this. It doesn't mean it's not fun to take a more extensive class with that, but if you understand the anatomy and the physiology and the theory base, then you can see where everything is running from. All the other strange stuff around pregnancy is that most miscarriages that are going to occur no matter what happen in the first trimester, in the first 12 weeks. And massage therapists and massage therapy businesses don't want to be held liable. You know, it's a correlation, not a causation. Correlation, two things happen together, but that's it. I got a massage and the next day I had a miscarriage. That the miscarriage would have happened anyway. But now people can connect dots. And so that's getting much, much better. There are still schools that are teaching you can't massage in the first trimester, and if you touch the feet, you're into this. Yes.
So, I have a friend who I see just hang out kind of regularly. We try to do like once a month hang out. And the last time, like 2 times ago, I went to see her and I was like, oh, I'll give you a massage for practice. What we didn't know was she was a couple weeks pregnant at the time. And nothing happened or anything. I just like.
Nothing would happen.
Exactly. But I was like, whoa, that's like different. And I remember how you had said that sometimes schools or people say that you shouldn't massage early on because of risk of
Oh, they got so many stupid things. Like you release all of this poison into the body with a massage, and that's going to poison the fetus. Or if you're breastfeeding, it's going to go into the breast milk. You have to pump your milk dry and dump it. It's just crazy, crazy, crazy
Is there
stuff.
anything else that should be known about that?
Those are the big ones. The reflexology misconception, and it's usually these like lateral points around the ankle joint, around the malleoli. I'll come over to the camera and show that. We can pass these around if you want. But
Yeah.
you have the pictures in your books, right? But showing that one. But look at the.
Don't forget Andrew over here.
Yeah.
Or Andrew.
But look at these points and lines, kind of, sort of, on the lateral and medial sides of the foot. And now there's meridian points I'm going to show too, but this chart just doesn't show the bottom of the foot. But there tends to be correlations between those two systems. So the biggest one regarding pregnancy is a misconception regarding this. My key argument against that is if you're wearing socks and shoes, it's putting pressure on those spots far more regularly throughout the day than I am with my massage. So I call garbage on the logic that can be built around that. If they're telling pregnant women to wear compression stockings so that they don't have swollen feet, I call a big, BS.
There he is.
Now, here are these meridian systems. Look how those lines come down and they follow a similar pattern adjacent to the Achilles tendon around the malleoli or onto certain elements of the foot. So a person could be doing point work or following a meridian line. It would maybe look very similar. There may be practitioners that are thinking both systems at the same time. They're thinking reflexology and meridian acupuncture, acupressure. And guess what? Those points also correlate 70 to 80% with trigger points. But the other one that she talked about is the detox idea. That by doing massage, we're gonna cause a person to fully detox and just, like squeezing a sponge, just all the toxic chemicals are gonna come out all at once. And then it's gonna attack It's going to attack the baby, or it's going to go into the breast milk, because why would it go anywhere else? The misinformation regarding the internet has become far less regarding this. No, those are the two reasons that people have it, where their concern exists, but it's not true. Ugh.
I found, I was looking for something else, and I came across an article that does an excellent job debunking all this, and I posted it on Facebook, and if I don't do it, somebody remind me. I can post it onto the Evolve site so that you can see where it's at. So we don't want crazy things to interfere. And people will say, yeah, but in reflexology, and I'll say, yeah, but I'm not doing reflexology. I'm doing a really, really good foot and hand massage. So there is a system developed by some nurses that is primarily to be used in the palliative care or in more of a hospice setting, but it can be used anytime when somebody is anxious. And it's called the M technique, And I'm going to walk you through that. You're going to be your own client just so that you see the pattern. We're going to do that on the hand.
As things spiral in your education, know that when you eventually are doing Zoom with me, we'll watch videos on that, but I'll show where the video exists.
So the way it's set up is the palm is up, and it's set up as a very static sort of thing. So your left hand, unless you are left-handed, is going to be the client, and your right hand is going to be the therapist. So the basic pattern is that you're applying a little bit of lotion through here, and it's 1, 2, 3. Everything is in a 3. And then we're going to come down, and it uses the thumb, but you're not applying a lot of pressure. So once you do that.
This is a demonstration.
Sorry.
Oh, there, okay, there it is. And then you're going to start at the wrist, and you're going to, each one of the joints is going to be a place that you're going to stop and do something. So you're starting with kind of a squeeze, and at that joint, you're going to stop and go around in a circle 3 times. And then you're going to press.
I have it actually going silent behind it.
Okay, and then when you get to a joint again, then you're going to go in a circle.
Both ways?
It doesn't matter. It's just a stop. And when you get to the end, you're going to just a nice squeeze.
A construct built into this is it never changes. It's
changes.
It's the exact same applications in the exact same order.
Then you're going to
always.
get yourself back down to the wrist. And I don't do it exactly the way they're doing it. You know, they're doing this crosswise thing in here. I get myself down there. The pattern is, then I'm going to do the same thing, and I'm thinking about this. So squeeze your way in. And you get to the joint, stop, a little bit of a circle, and squeeze your way up or slide your way up, and joint and circle. That's the pattern. And then you would turn the hand over and you would do it from this side. So why don't you go ahead and turn the volume up on that.
Almost any pattern would do. But
Yep.
This is one that has been formalized and is established in the medical community. So it's worth being aware of, and it's easy to revisit and memorize. But it speaks to doing something the same way, because there can be a pattern recognition. You know, there's a whole Pavlovian construct that occurs with people. But one, it allows a practitioner to have a memorized thing where you're no longer thinking about what you're doing, just like ideally you get to with your whole routine. But for the client, something that is replicated the exact same way, there's something to how that can help further induce that parasympathetic dominance. that it's the exact same sequence associated with that experience every time. You know, the practitioner comes into the room, it could be different practitioners, but then the starting point, the patterns, and the ending points are all exactly the same. So this conditioned response that we can get with people, we can't discount how sometimes that can be incredibly useful.
So I'll let you listen to her for a minute.
If we start
Depending on the size of your child's hands, you will notice you need to change your hold from the supporting thumb hold to the small finger hold to reach all fingers.
pretty most of the way through, we'll walk it through the whole thing then.
I'll just watch it for a minute. Just watching it is hypnotic. Anybody feel themselves go, huh?
This half, a little pressure on the finger, but this kind of.
Now, there's something to be said for routine and similarities. People will say, well, the massage needs to be different every time because the client is different every time. That may be, but the way the room is set up, the way you look, the linens you use, the music you use, all that kind of stuff, the more reliable and similar and familiar it is, the more the person is going to relax into the environment.
I would have people literally miss their particular sheet. Like, where are my hot air balloons? Where's the plaid? There's a whole thing to this that really does help. And then for the practitioner, I feel very strongly that the reasoning behind so many specific patterns and modalities is more about giving the practitioner something so that you can get in that meditative state, that you're no longer thinking about where you're going to go next. Most of your massage should be like that.
Yes.
When you've completed the back of the hand, turn the hand over.
Mwah.
There you go.
Yeah.
Link your little fingers through your child's little and fourth fingers so that their hand is facing
And
up
again,
between your
it's
two
more about the
upturned palms.
sequence and the routine and how
Using
we
your
can
thumbs
teach
only,
somebody.
stretch out the palm of the hand using horizontal strokes, working from wrist area to knuckles. Repeat this sequence 3 times.
Now, the bigger issue for the massage therapist is your body mechanics and to reduce the tendency for you to use your hands. And that's where I want to focus on in terms of the demonstration, is how can we be effective in this area with our positioning and the way we when we decide to do a particular
When you finish
body
the
part.
third sequence, slide
So-
your hand into a handshake hold.
Let's go ahead
Supporting
and
your
take
child's
about a
hand, stroke the
15-minute
lower arm,
break,
allowing your child's arm and
and
hand
we
to rest on
will
the bed.
set up for a demo so that you can see that. And I'll